Okay, so as we said, our presentation today is on oral health and how oral health is healthcare. So as we were introduced, I'm Dr. Michelle Scholtz. I'm the Chief Dental Officer. This is Kim Ball. She's our dental manager. She's been with us for 3 years, I believe. I could be wrong. And she helps kind of with the oversight of the dental programs and clinical management for the teams. Here's a little video about Horizon Healthcare.
Horizon Healthcare is named so for a reason. We not only span across the horizon of communities in South Dakota we call home, we span the scope of care for all ages, races, and special populations, regardless of their ability to pay. Veterans, ranchers, teachers, Medicaid, Medicare, those with or without insurance, in person or via a screen, Horizon removes barriers to care. We rise each day to serve, and serve high-quality, comprehensive, patient-focused health care. What does that mean to the communities and people we are invested in? As a federally qualified health center or community health center, we serve all with affordable access to care. We further break down barriers by offering a sliding fee program, which provides discounts on services for eligible applicants, as well as 340B, a prescription drug program that reduces prescription costs through local participating pharmacies. As healthcare providers, we are woven into our communities, helping the main streets and back roads that are often underserved. Established over 4 decades ago in the communities of Howard and Bryant by concerned citizens who wanted to secure healthcare in their communities, Horizon has expanded, merged, grown, and improved access to quality care. In 2016, our Horizon Health Foundation was established. It ensures that we continue to invest in our communities with facility upgrades and the addition of necessary services. Our clinics deliver affordable access statewide with modern telemedicine technology that removes the barriers of geography and travel. Our providers are your neighbors and community members, dedicated to providing quality care close to home. Horizon Healthcare is committed to forward-thinking care in medical, dental, and behavioral health. We spread this care to vast rural regions that might otherwise be left in the cold, and we have been nationally certified and recognized for it. And our dedication to wellness spreads through all phases of life. Our priority is the communities and patients we serve. Experience our mission and be part of Horizon Healthcare.
So that video gives you kind of an oversight of kind of our mission, vision, and values for Horizon Healthcare. Let's see. There we go. So like the video stated, we are a federally qualified health center. We do get some grant funding to help the underserved and provide access to care for rural, remote areas, patients unable to afford care otherwise. So we have 34 medical dental sites located throughout the whole state. This is just a map that kind of shows you the network of community health centers within South Dakota. We're not the only community health center. There are 5 different community health centers in South Dakota that provide health care to those that are underserved or lack access due to locations. But all the purple sites are our Horizon sites, and then we have 8 dental clinics kind of located throughout the state. So we span on the dental side from Faith all the way down to Elk Point. So we have quite a span throughout the state, but we're able to provide medical, dental, and behavioral health through our on-site clinics, and through telehealth and teledentistry as well. So on to kind of oral health education and our talk today. So some interesting children dental health facts when I was preparing for this presentation. Let's see if this will. So this document, can you still see this document?
It is just a black screen. You might have to stop sharing and then reshare on that screen.
Yep. So this is a document put together by the Department of Health, but a couple things that I thought were very interesting, coming from the oral health side, we know that untreated tooth decay is a big concern for our children and adults, but children miss a lot of school because of oral health issues. But one thing I thought was interesting in this little pamphlet was that children in South Dakota have more tooth decay than the general population. So obviously we have a long ways to go in South Dakota to help promote good oral health and habits for our children and for our adults as well. Okay, so I think good oral health habits for children start as early as pregnancy. So educating our pregnant mothers about the importance of their oral health and how that'll impact their unborn child and their child after they're born. So one thing I think that's very interesting that people probably don't realize is that dental caries is infectious and a transmissible disease. So what that means is if a parent or a mom or a caregiver has an unhealthy oral condition, so if they have active decay or active periodontal or gum disease in their mouth, that bacteria can actually be transmitted onto their child by sharing utensils when eating or just, showing affection and whatnot. So I think a lot of people may be surprised to hear that it's actually an infectious disease that can be prevented from having good oral health as a parent or a caregiver. Another misconception that people have and has changed throughout the years, even as I've been practicing, is that we don't want to delay treatment for pregnant women. In the past, there were concerns about pregnant women having x-rays or the anesthetics that we use, but there's been a lot of research that shows that it's actually better for a pregnant woman to have that treatment completed so that they have good oral health before a child is born. And then many pregnant women actually have Medicaid benefits for a short period of time because they're pregnant. And so they could have additional dental benefits, which they may not have normally. So this is actually a great time for them to get treatment that's needed to kind of start the process for their children as well. And pregnant women also have an increased risk for decay, oral health issues. A lot of times, we'll hear in the dental clinic, patients will come in and say, when I was pregnant, the child robbed me of my calcium or whatnot, and that's why my teeth are bad. But the truth behind it really is that when people are pregnant, they tend to have more nausea. So they maybe are increasing their carbohydrate intake because they're snacking on crackers or anything that is making them feel better. So that actually has a bigger impact on their oral health, kind of those change in habits. Because of that nausea, sometimes they have a decrease in their oral hygiene habits, so that can also impact kind of their oral health as well. They're maybe not brushing as frequently because, it makes them uneasy and whatnot. And then hormones can have an impact on pregnant women's gingival tissues, their gum tissues. It can actually cause more inflammation. So be more proactive while you're pregnant to take care of your oral hygiene can play a big impact in the long run. So after pregnancy, then we have our newborns and children and kind of starting off on the right foot. So it's good to educate the pregnant mothers before they give birth on some of the things that they can do to help start their child off with decrease in decay and whatnot. And so talking to parents, we spent a lot of time educating parents on the importance of brushing their children's teeth twice a day, starting as soon as that first tooth erupts in the mouth. There was a period of time where fluoridated toothpaste wasn't recommended for children, but now it's recommended just using a pea or a rice size amount of toothpaste for the children, just to get some of that topical fluoride and onto those teeth. Another education piece is talking about what is put into the children's bottles and sippy cups. A lot of times by the time we see children, the decay may have gotten so severe that we want to prevent that by talking to the parents about reducing sugary things in their bottles and sippy cups, because that can play a big impact on decay. This includes milk and breast milk, which I think parents may not realize. They may think that it's healthy for their child to walk around with a bottle or a sippy cup with milk in it, but milk actually has a lot of sugar in it. And so we wanted to kind of limit the duration that a child is exposed to that sugar. So limiting that in their sippy cups to only meal times is preferred. Encouraging the children to drink from a cup by their first birthday, limiting the bottles helps with the oral development, kind of where the teeth align as well. Visiting the dentist by the time the child turns 1. So we were just at an oral health conference, and there's a lot of dentists that are hesitant to see children by the age of 1 or the younger children, because they're not always as cooperative. But a lot of times the reason we want to see children as soon as they have their first tooth or by the time they turn 1 is we want to talk to the parents about limiting these sugary beverages or snacking and kind of good oral health habits to set them up for success. So one thing that can happen is if we're not able to educate parents and children do end up with early childhood caries, a lot of times, you'll see this in their upper front teeth. You'll see kind of the dark decayed areas, but other teeth can be affected as well. Typically, the most common cause of this is the duration that their teeth are exposed to sugary drinks or snacks. Children tend to snack quite a bit, and it's very easy to give children like crackers or goldfish to snack on throughout the day. And parents may not realize that that's really bad for their teeth. So trying to educate them on different healthier snacks that can actually benefit their teeth in the long run. And then talking to parents about fluoride in their water, in the toothpaste, because fluoride, when it's ingested as the teeth are developing, it can actually prevent cavities from happening because it can create a stronger tooth structure because it gets incorporated into the tooth structure as it develops. So I just thought I would show some pictures these are just from the internet, of early childhood caries, the things that we really want to try to avoid, because this can be very painful for the children. It can impact their eating, because if their teeth hurt, they're not going to eat. And it can impact their permanent teeth as well. If they have infected teeth that don't get taken care of, infection can actually impact the development of their permanent teeth as well. So trying to avoid this as much as possible. So there are different snacks that we talk to parents about for healthier snacks for teeth that don't actually cause cavities. So, in the younger group, some of the things are a little bit harder, but trying because of their ability to eat them. But, dried meats, hard cheeses, crunchy fruits and vegetables, nuts, all these things don't cause cavities. And so those are healthy things for kids to snack on throughout the day. What kids tend to snack on and what they kind of lean towards are some of the unhealthier things. So we tell parents that really children shouldn't have a need for having juice. So trying to avoid juices at all costs, or having it as a special treat with a meal if possible. Really trying to limit those carbohydrates. That's the most common thing that kids probably snack on. I know as a parent, I'm guilty of this as well. It's just an easy thing for kids to snack on. So just really trying to limit the duration that kids are exposed to these things. And the biggest thing is frequency. So I have another diagram, 2 slides next, that talks about the frequency, but sugary beverages. This next diagram will show there's 2 things that help expedite tooth decay. And so one thing is the amount of sugar in the beverage or food that they're eating or snacking on, and the acidity for different drinks that they may be exposed to or drinking throughout the day. So pure water is obviously the best thing for teeth because it's a very neutral acidity level. But anything other than that, you have a little bit more acid that's also involved on top of the sugar. So some of the things that you can see, like if you look at Coke and Pepsi, we're getting really close to battery acid. So anytime someone's drinking one of those beverages, you're basically bathing your teeth in battery acid. So the breakdown happens that much quicker. Another thing that we talk to parents about is the frequency of snacking. So there's a couple different things that cause cavities. One is bacteria, one is acid, and then the frequency. So anytime someone eats or drinks something that has acid or kind of a sugar carbohydrate, the pH in your mouth actually drops below to a more acidic level, which helps break down what you're eating. But the problem is that acidity level lasts for 20 minutes. So every time that you snack on something, your acidity level drops down for 20 minutes. So if someone is constantly snacking, their acidity level in their mouth can actually be quite low, and that's where the teeth start to break down and you have an increased risk of decay. And so really educating on limiting snacking to certain durations of the day and not just that constant snacking throughout the day. One thing to help combat tooth decay is fluoride in water. So community water fluoridation was actually one of the top public health achievements. And so making sure that your communities have water fluoridation is important. And talking to people about what types of waters that they actually drink. So a lot of people, you may have community water fluoridation, but if you're drinking bottled water, you may not have that fluoride exposure because some bottled waters actually filter out fluoride from their water. Another thing that we've been seeing a lot more of is people having the reverse osmosis systems in their houses or just different filters with their water faucets, and that's filtering out the fluoride. So they're not getting that benefit of fluoride in the development of teeth. So just making sure that people are drinking regular tap water that's fluoridated. And there are studies that prove that fluoridation helps reduce decay by more than 25%. And then there's other things that have been fortified with fluoride. So just kind of checking on the label. But I think the biggest thing that we've been seeing more and more of is just the filtered water, or people drinking a lot of bottled water that doesn't have fluoride. So, and they may not realize that that can impact their children's tooth development. At Horizon Healthcare, we have a program that we started in 2018. This is just basically to promote access to care for the children in that 0 to 5 age group, to promote education for the parents, to start the kids off with good oral health habits. And so we provide free cleanings, exams, fluoride, x-rays for the kids 0 to 5 in the month of October. Since we started this program, we've been able to help 768 kids. It's great. It's great to see kids, there's a lot of kids that come in that don't have insurance, and financially it's been a barrier. So that's why they haven't brought their kids in. But there's a lot of parents also that have insurance that we see, and it's just a good way to encourage them to come in and show the importance of that good oral health foundation at the beginning of the tooth development. We're able to offer this program because due to our foundation and generous donors. Some of the sources from today's content was from the American Dental Association, the CDC, the Department of Health, and Sip All Day, Get Decay. And you will have my contact information in Kim Ball's. If you want something answered quickly, add Kim Ball to your questions, but otherwise.
Thank you, Dr. Scholtz. That's a great presentation. I would welcome anyone to ask any questions at this time. Again, you can use the chat or also the Q&A feature at the bottom of your screens. And I did want to give Kim Ball a chance. If you had anything to add, Kim?
Nope, I think that has covered pretty much most of it. Just one thing I want to add about kids and their coverage. They do have coverage under Medicaid. So I know sometimes people don't think about dental care being covered by Medicaid, but children do get that dental coverage. And so you can come in for a cleaning and exam 2 times a year, and that will be 100% covered by Medicaid.
We do have a question in the Q&A. Is apple juice okay for children to have, and how much?
So it all depends on the duration of exposure. So typically, like even my kids, for example, we try to keep it as like a treat. So like we try to do it during a lunchtime or something like that, not in between meal times. Because every time a child takes a sip of the apple juice or any juice, it starts that acid attack on the teeth over again. So if they're kind of sipping on that juice, throughout an afternoon, their teeth never have the ability to or the acidity in their mouth never has that chance to neutralize. So I honestly just recommend limiting juice in general or having it as a special treat.
Another thing too, if your kids are really stuck on it, you could cut it with some water. So they, more water than juice, they might have a little bit of the flavor of it, but that's one way too to help with that. If they're really big on juice, that can help wean them off by just slowly adding water to get them back to maybe just straight water.
Another question is, how do you tell your child it is okay to go to the dentist because they're scared of going to the doctor? What tips or tricks can we use?
I think first, maybe finding a dentist that sees more children can help. They're more equipped to dealing with anxious children that may be, scared of the doctor or scared of the environment. There are books out there, I don't have any off the top of my head, that talk about like what a dental visit is like, and kind of shows them the different tools that we use, and then that can kind of help ease their anxiety as well. I know at Horizon we're kind of working at it's not we haven't launched it yet, but we're working on a platform where we would be able to kind of introduce the kids into our clinics. And especially with COVID nowadays, you know, everyone's wearing masks, so it's a little scarier to begin with. And so allowing the kids to see who we are and kind of show them some of the stuff that we're going to be doing can help ease their anxiety. Another thing that you could do as a parent is bring them to your dental visit. Have them sit and watch you at your dental visit so they know it's not scary.
Absolutely. Thank you. Okay, I think I have another question. What education do you give parents on milk consumption for kids? There was a huge push for milk for such a long time, so it's a hard habit to change. People do not see milk as a contributor to dental caries. Do you have any advice on that?
Yeah, so what I tell parents is that milk is good. It's got a lot of, you know, calcium. It's a lot of times fortified with vitamin D, but just using it at mealtime. So just try to stick to anything that's not water at mealtime. So that just reduces that exposure time.
Great.
I had one thing to add to that too, Shannon. And if so, like my nieces, they always like to have a milk before bed, which is not ideal. But if that is also something that you do in your house, just making sure you maybe brush them again before they go to sleep, so that isn't just sitting on there all night, or for sure drinking some water before going to bed.
Great. Good questions. I'm not seeing any more at the moment. If there are any more, we'll give it a second for more to come in. In the meantime, I would just like to point out that I posted a link in the chat to our evaluation feedback form. It's just a couple questions. We appreciate everyone's comments and feedback. If you have a chance to fill that out before exiting the webinar today, we really appreciate it. Otherwise, in the chat, I'm just seeing lots of thank yous and great presentation.